Hello, everybody. I know yesterday or the day before when I tried to talk about my new job, my boyfriend walked in and it was just really weird. I couldn't do it. I've never filmed in front of somebody before, so it's a little awkward. But I just wanted to hop on and chit chat about my new job with you guys and answer any questions that you guys had when you joined this video. Today was a really good day. The doctor I worked for, she's super quiet and she loves to get things done. So, yes, my cat is going crazy today. So the doctor that I worked for today, she's really quiet. She likes to get things done. She's in and out of the patient's room super quick. And today I saw a little bit of everything. We had some patients coming in with, some bug bites. We had hives. We have a lot of pre-ops. We have hospital follow-ups. And no EKGs today, but I have done those. Last week I did a couple, quite a few actually. And then, tons of vital signs. And I started refilling a lot of prescriptions for the provider that I'm going to be working for today, just to kind of get a grip on like what his process is on how he wants things done. And it's really good because some doctors will just fill a prescription for anybody, and here, if they don't prescribe it to you, especially if it's a narcotic, they will not refill it for you. You need to go to the person that gave you that medication, and I like that. I also like that this practice, these doctors like to really give you like pain management and give you alternatives to treatment as opposed to just sticking you on medication, which is big for me because I like to treat things holistically. And I don't like to take medication unless I absolutely have to. And a lot of patients, especially the older ones, oh, thank you, Kobe. The older patients don't like to take a lot of medications because they already have diabetes, heart failure, or high blood pressure, and they're already trying to manage their cholesterol along with their high blood pressure. So adding more and more medications to their list is just stressful for them. So they try to take a holistic approach and make sure that they're taken care of, which is the most important part. What else did I do today? We put supplies away. We swabbed somebody for strep just to make sure that the person didn't have strep and it came back negative. Because this time of year, a lot of people start getting the scratchy throat and they think strep. This time of year, because of the allergies, most likely you just have a postnasal drip and it's congestion or, sinuses or allergies or both. We've been seeing a lot of people coming in with sinus infections, so we're putting them on a lot of medications for that, or, telling them to just flush it out with some Nasacort or Flonase. What else did I do? That's really all. I love this place that I work at primarily because at the end of the day, the doctors say thank you. The nurses work as a team, and let me tell you, something that you must have as a nurse is a good pair of shoes, because you are going to be running ragged whether you're in the hospital or you're in a doctor's office or a nursing home, surgery, like plastic surgery, wherever you work, you need good shoes. I spent $74 on a pair before I started here. I got two pairs and they were $74 each, and a lot of people were like, oh my gosh, that's so outrageous. But at the same time, you're going to be paying for quality. They were Grey's Anatomy shoes, and I don't like how narrow the footing is because I have weird toes and it kind of mushes my pinky toe, but they're very comfortable. They do, at the end of the day, my feet do not hurt at all because I do wear the clog type shoes. And then the other day, I had to go get more scrub bottoms because I'm trying to have a pair for every day of the week so I don't have to do laundry all the time. And they had these little clogs on sale for $20 on the wall, and I ended up getting them. I got two pair, one with hearts, one with some leopard print. So maybe I'll show you guys my shoes one day, but they were just so cute. So I went ahead and got more scrubs, and I got some shoes. I like to have a good stethoscope. I treated myself with my new job with a great company. I went ahead and splurged and bought myself my first Littman. It's the classic Littman 3. I got it in plum purple, and I got it engraved with my name, comma LPN on the bell, so that in case somebody steals it or borrows it and doesn't want to give it back or doesn't give it back, I can go finding my stethoscope. So definitely invest in a good stethoscope and good pairs of shoes. What else? You definitely want to work as a team. Don't be the nurse that doesn't help anybody out, because that is just no bueno in the nursing field, healthcare field, period. Any job, period. Don't be a non-team player. Everybody's there to care and get the job done and go home. But definitely invest in a good set of shoes, a good stethoscope. I also purchased a really cute purple pulse ox off of Amazon for like 20 bucks. It takes AAA batteries, and that's a quicker way to go ahead and get their pulse. And right now I'm not using it because I haven't stopped to buy batteries for it, but there's a bunch of different ways. Bob shoes. What are Bob shoes? There are different ways to take somebody's pulse. You can hold their radial pulse for 10 seconds times 2. You can do, like, I usually do 10 times 2. What am I saying? 30 seconds times 2. You can do 30 seconds times 2. You can do 10 seconds times 6. So in that 10 seconds, if you count 7 pulses, you're going to do 7 times 6. Because 6 times 10 is 60, and there's 60 seconds in a minute. And pulse ox, some of the providers that I do work for want their pulse ox or their O2 sat. Some people don't. So it just depends on the provider. And I do encourage you, if you do work in a doctor's office, since I have primarily only worked in doctor's offices since becoming an LPN, you definitely want to get in a good rhythm with your provider that you work for primarily. And even ones you're filling in for, you want to know, like if you're filling in, no, I don't wear Skechers. You definitely want to know how the provider that you're working for likes to work. Some providers like to take longer in the room with their patient and really get deep down into their history. Other providers, no. Other providers like to get in, oh, you're here for hives, let me treat you for hives, bye, see you next time at your annual. You know, they don't want to go into their whole problem list, because then it's going to take up their whole visit. And the reason behind that is because of scheduling. Here, where we do like the Medicare wellness checks, we have time allotted for 30 minutes. A regular checkup appointment, paperwork appointment, med check, 15 minutes. You're in and out the door. Yes! My cat is going crazy today. So you definitely want to get in the flow, because you don't want to be holding up your doctor. You want to get in and out of there. So the provider I worked for last week and up till today, her schedule is 7:30 to 4:30. So I have to be there at 7:15. You have to be 15 minutes before your shift starts. That way you can set up the room, look at the schedule, and usually your doctor will huddle. You'll huddle with your doctor and make sure that the schedule, you guys are on the same page. Like, you know, there's older women who come in for a GYN exam, and if they've had a total hysterectomy, there's no need to go ahead and do a cervical screening, because if they've had a complete hysterectomy, they don't have a cervix or a uterus, so there's nothing to swab. They're going to do a vaginal exam and be in and out. Yes. Even though you're a phlebotomist and you're getting a position offered to you in a different field, if you're going to be offered that position as a transporter in a hospital, I would definitely take it, because you're getting your foot in the door. One of the reasons I took this job is not only because it's with a great company, but because there is room for growth. So I can start now as an LPN. If I was to go back to school for my RN or even my BSN, which is my Bachelor of Science of Nursing, they are going to do tuition reimbursement as long as my grade is a C or better. So I could go to school all the way up to my master's if I wanted to, and this company is going to reimburse me for going. The problem with that is I have just started this job, so I don't even plan on going back to school right now because I love being an LPN. Being an LPN has already opened so many doors to me, and I'm still learning so many things because I'm still a new nurse. I've only been doing this August will be 2 years. So getting your foot in the door just shows them that you're willing to learn other things aside from your actual job title. So if you're certified as an LPN or you're a certified phlebotomist or a medical assistant, and say they offer you to be a transporter or they offer you a position as the receptionist or medical biller and coder, and you have that certification, you should take it, because depending where you work, when open positions like where I am, if an open position pops up, say at the hospital or at another practice that's closer to me or in a different variety of like orthopedics or pediatrics or cardiovascular, I can apply for a transfer and they're going to transfer me. So if you take the job as the transporter, you work as the transporter, learn all of that, that's also another thing on your resume. And you can look within that company for new openings for phlebotomy. And there's tons of companies out there that need phlebotomists. There's LabCorp. You can work for Centera. You can work for just all kinds of doctor's offices. Even mine. We hire phlebotomists just to take blood for us because the nurses are busy filling prescriptions, taking vitals, pulling patients back, calling in lab orders, calling patients to make sure they went to their hospital visits, calling for hospital follow-ups. We're getting the reason why they're there. We're updating their charts. We're taking medications off of their medication list. We're updating their medication list. You know, we have a whole list of things to do, and the last thing we're thinking about is drawing blood, so that's where the phlebotomist comes in. Thank you. So definitely get your foot in the door. Also, since you spent the time getting certified as a phlebotomist, you should work in that field. Healthcare, you are always going to be needed in healthcare, whether you're a nurse, a doctor, a transporter, medical biller and coder, and insurance. What are you doing? Excuse me, I just burped. Whether you're an insurance verifier or you're working the front desk and greeting people, you're part of that team, and you're what makes the merry-go-round go round. You know, we all work as a whole to get things done. It's very hard to take care of people, and the majority of people that we see in our practice are geriatric. 60s, 70s, 80s, 90s, even 100-year-olds, okay? As you age, your memory starts declining, so they rely on people like myself and other people in the healthcare field to help take care of them and keep things in check. So that's why it's important for the nurses to call and follow up to make sure they went to their cardiovascular specialist or if they went to their physical therapy appointment. We go through a lot of time and effort to schedule these appointments, and most of the time it's the younger patients that don't really follow through and go through with things. But you know, if we go through all the hoops, loops, and jumps and turns to get you into a great physical therapy appointment and you just blow it off because you feel like you can do it yourself, you know, that's a waste of my time. I could have given it to, you know, an 80-year-old who just had hip replacement surgery, and they've been waiting for a great physical therapist for 2 weeks, and they're still waiting in rehab for a physical therapist. So that's just my view on it. But yeah, I think the transporter job is a real good opportunity for you. You'll learn the ins and outs of, you know, the hospital, wherever you're going to be working, and you'll also learn the terminology, the lingo, how things really roll in the hospital if that's where you're going to be. And it can take you anywhere. You can start from the bottom and just work your way up. And that's why, you know, a lot of people, every time I'm at work and they're like, oh, you're an LPN, are you going to go back for your RN? I really don't know, because being an LPN, I've already done so many things just within the year and a half that I've been an actual nurse. And even as a CNA, like I would have been a CNA forever if it would have paid better. I loved taking care of my geriatric patients. And that's why when I'm working at work now and the little 80-year-olds come in, I'm just like, oh my gosh, you're so adorable. I just love geriatrics. So I love nursing, period. And nursing has to be your passion if you're going to be in the nursing field. If you don't genuinely care about people, if you don't care about yourself, if you have rude customer service and you don't care about the well-being of others, do not work in healthcare, especially. There's nothing worse than going into a facility of a healthcare type and they act like they don't care that you're there. You walk up to the front desk and they're just like, oh, hi, how are you? You want to be somewhere where they're like, hello, how are you today? You're here for an appointment with so-and-so and you're getting this done and that. You want people to greet you as if their whole world revolves around you, even though it don't. And that's why I treat all of my patients like they're my own kin, You really have to prove to them that you care. If you don't care about your job, it's going to show. Plain and simple. So, what's the matter? You meowing at me all day. But yeah, it was nice getting off at 4:30. Tomorrow I'm working with my primary doctor that I will be nursing for. So his schedule is 8 to 5, which means I have to be at work by 7:45, which is really kind of good because I get to sleep in a little bit because I've been getting up really early to make it there. But I really believe that everything happens for a reason, and I'm glad that I took this chance to work for this amazing company. I mean, they offer great benefits. They offer on-site training. I had an email today for more training that they're going to offer later on in June, and anybody can go, and you even earn like 3 continuing education credits for going, and it's only like 4 hours. So I just love healthcare. I don't know. I really don't know what I would do with myself if I didn't work in healthcare. So that's that. I don't know what else to talk about. I'm trying to think of other things that happened. What's the matter? You talking? Hello, how are you? What else should I talk about? I don't know what else I got a Starbucks because I'm like addicted. I have to stop, but I'm addicted. I don't know what else we did today. We did the throat culture for strep. Tons of UAs, tons of urinalysis. And the one lady that I dipped her urine, lots of blood and leukocytes showed up, so there's definitely infection there because the leukocyte reading was large. And I'm not used to putting a dipstick in a machine. I'm used to just looking at the bottle after I dip it like I did an OBGYN, so getting used to using a machine that reads it for you was very, very different. And when I told them that, we used to just dip it and keep it moving, they're like, oh no, we stick it in the machine. And I'm like, this is kind of it takes like 2 minutes for all that to happen. So someone just wrote a comment. I just want to know I'm a second semester in school. Everybody's help me pass my first. Oh, great. I'm so glad. You're so very welcome. I love sharing my journey because I've been through a lot in life, and I share everything with you guys. Yes, you definitely need to pursue your phlebotomy career. Not only are you going to learn amazing skills, you also might want to pursue a different healthcare type of career like nursing or becoming an x-ray tech or something along those lines. Healthcare is going to open up so many doors for you. And like the more I go to work every day, like when I wake up, I'm rushing. I'm like, I gotta get to work, even though the doors don't open till 7 and our patients don't come in till like 7:45 or 8 o'clock. I'm running. Like I'm ready to go and I'm ready to learn because every day I've been learning new things at my job, and that just makes me so excited to be a nurse. And that's why I'm kind of on the fence about getting my bachelor nursing of science, maybe master's, because I would love to teach nursing. But at the same time, primarily when you're a registered nurse in my area, you're going to be working in the hospital. And one of the main reasons that the hospital nurses are so tired is because they're overworked. In my area, they took a lot of the LPNs out of the hospital setting to work in, separate practices such as I do, like by practice. It's a bunch of providers under one roof, but we are under the hospital. So whenever they go in the hospital for certain things, they follow up with us instead of going to the hospital and finding the doctor that operated on them or treated them for pneumonia or bronchitis or, a heart attack. They just follow up with us. So the nurses in hospitals are so overworked because there's no LP in there to just straight cath a patient that they need to be straight cathed, or, put a new IV saline on the pole, check their IV site, give them their medications, take their vitals. We're not in the hospital to help them do that. So that's why they don't work a normal shift, and that's why a lot of them are so exhausted. I'm just trying to reply to everyone's comments. And you can do that too. Like home health, working in home health is great because, not only, I think it's great that people work in home health because, especially hospice, because, excuse me, I don't know why I keep burping. So, a lot of older people would like to pass away at home. They don't want to be somewhere foreign to them, like the hospital where there's a bunch of people around. Most people want to be surrounded by their loved ones, especially if they're terminally ill, or especially if they sense that, they're going to go. A lot of people can sense when it's their time. So working in home health, I think, is great because you're giving those people the opportunity to carry out their final wishes of staying at home and passing away peacefully. No one wants to really pass away in a hospital where there's machines beeping and nurses coming in and out of the room every 4 to 6 hours. That's just crazy. So home health also gives you the opportunity to get certified in certain things like trach care, G-tube, peg tube care. You can learn to do wound care. Should I apply for LPN school? I am almost... Whoops. It is just like home health CNA said, it is never too late. When you want something, you need to go for it, and you can always apply for an accelerated program like I did. It was technically 14 months, but I took a break because my then boyfriend was deploying, so I took a leave of absence, so it ended up being 18 months for me. But the program I completed was 14 months, and they even offer a registered nursing program for, I think that one's 16 or 18 months. But either way, accelerated program, you still get to take the same state exam that every other nurse in your state has to take. You're still a registered nurse, or you're still an LPN or a medical assistant, even though you took an accelerated program. Accelerated programs just mean everything you're learning in that 4 or 5 week course, you're learning what a normal student would learn in 16 weeks. So it's a heavy workload. It's very demanding, but if you want it, you go for it. It's never too late, plain and simple. And even if you didn't want to do LP in school for 14 months, you could always take up like a certified nurse aide course, become a certified nurse aide or a PCA, which is a personal care aide, and just learn to take care of people as a CNA or PCA in a nursing home or do home health. That's what I started out as. I was a CNA for 3 years, and it didn't pay very much, but getting the pleasure to take care of people when, their sons and daughters have their own lives and they need someone to rely on to help feed them or help bathe them, help do their laundry because they can't do it anymore, and you're the person that helps them, that's what made me fall in love with taking care of people, especially since I took care of my grandma at such a young age. She is the reason I chose nursing. I originally wanted to be a kindergarten teacher, so I took the completely different path. And I'm glad I did, because nursing, I feel like it is my calling. I feel like I've just genuinely been put on the earth to help people, and that's what I love to do. And it goes outside of hospital or my facilities setting. When I'm out, I'll hold doors open for people. If someone drops a bag or needs help carrying a bag, I offer to help carry the bag or open their car door. Like, it's good to be kind, and that's what I'm doing. It's just, I don't know. You really have to have the heart for it. So you could always do an open house and go tour the community college or university or tech school that offers nursing classes or CNA classes. You could always do an open house and just see what their programs are all about and how demanding it's going to be, and if it works with your schedule, or if it's really something that you want to do. You could also volunteer at nursing homes and get used to being accommodated with the geriatric people, just so you know what type of personalities you may end up dealing with. Yeah, so I don't think it's ever too late. I think if you really feel like it's what you want to do it. Definitely. And that's why I'm not really in a rush to get my bachelor's, because I'm 26. To me, that's not old, but it's not young. And if I was to go back to school, my cap is 30. So at 30 years old, that's when I decide, okay, you're going back to school for your bachelor's or your master's, and then you're done. Because right now I'm really enjoying working, and I'm really still learning the ropes of being a nurse. You know, there's so many seasoned people at my facility now, and I'm learning so many new things, and I'm learning their computer program, because every company uses a different computer program, and EMARs, you know, the electronic medical records, and learning how to yeah, the age of figuring out life, right? That jet was really loud. But yeah, you know, you really just have to figure out where you want to go and what you want to do. Don't live through someone else's dreams, or don't do things to make somebody else happy other than yourself. You know, I know tons of people who go to school to become a lawyer or a business owner or take over the family's business, and it's not something that they really want to do. You need to do what you really want to do, because at the end of the day, if you love your job and you love what you do, just like the saying, you'll never work a day in your life. Literally, when I wake up and I go to work, I'm bringing them patients back, I'm helping them get cared for, and I don't even feel like it's work. Like, I'm just like, I'm getting paid for this? Like, what? Like, it's not even hard for now, until I, you know, really get into it. And, you know, later on down the road, if I'm still at the company, you know, 5, 10, 15 years from now, there's going to be a newbie nurse just like me who's overwhelmed, who's scared, who's not knowing what they're doing. Girl, I've been there. Been there, done that. And it's every job. It's not just nursing. Whenever you start a brand new job, it's like starting completely over, writing your story in a blank book. You got to learn the way they want things. You got to learn their programs. You got to learn how their protocols work, everything. So it's definitely normal to feel out of place. It's definitely normal to feel overwhelmed. That's all I'm going to say. Someone wrote a comment. Part-time LPN. Yeah, so worst come to worst, you could always apply for that part-time LPN program. And if it's anything like my program, your first couple of terms is going to be your prerequisites. Your anatomy and physiology, dosage calc, pharmacology. And then we had like this study course that teaches you how to study and write papers and stay on track and stay organized throughout the program. But those are primarily going to be your first couple of classes. So once you get into like your first actual term of nursing, which will be like fundamentals of learning how to care for somebody and giving bed baths and things, that's when you'll really know if this career is for you. If you can't, so if you can't stomach blood, or you don't like bowel movement, like you can't deal with feces, you can't deal with vomit, blood, anything like that, I wouldn't recommend. I mean, obviously you can deal with blood because you came a phlebotomist, but if you can't deal with things like that, or you don't have the patience to deal with an elderly person who walks really slow, or an elderly patient who has no one else to talk to but you, so their 15-minute appointment turns into a 35-minute appointment because they just want to keep talking and talking and talking, it's not for you. So I would definitely try it though. I mean, you never know. You might fall in love with it. And there are times, you're going to go through the program and be like, yeah, I really want to work in cardiology, or I want to work here in med surg. And then you could end up in OBGYN because that's just your niche. That's where you get in where you fit in. Your first job out of nursing school could be what you really want, could not be what you really want. And that's why I was so fortunate when I graduated, I got my first job in OBGYN because I loved my OBGYN labor and delivery clinical. I was so blessed beyond belief to get that job. And it taught me a lot, and I got my year of experience, and then I tried something else, and that didn't work out, so here I am now. As far as how's my new job going, how they're treating me, my new job is going amazing. All of the nurses work very well together, and they're very informational, they're very helpful. I haven't really ran into too much trouble training-wise, except for like the beginning of last week when they were teaching me how to refill prescriptions. There's certain ones you have to call in. There's certain ones you have to print because the patient likes to pick them up and take them to their preferred pharmacy. So just learning those types of things, that was kind of, like, whoa, okay, now I know. But it hasn't been hard adjusting, just because, especially the doctor that I worked for last week and yesterday and today, she's like a fast-paced doctor, and I'm used to fast-paced because I worked in OBGYN, and we saw like 20, 30 patients a day, and I was working with multiple providers at one time. So running back and forth is like my calling. That's just what I do, and it keeps my ADD in check because I'm always moving and I'm always doing something, so I don't really have time to be distracted by anything else because I'm busy working for that patient. So it's going really well. Yeah, I just wanted to chit chat with you guys and catch you guys up to speed and let you guys know how everything's going. Oh, well, thank you. Yeah, a lot of people, they tell me that I'm so mature, and good. I'm glad that there's no prerequisites for that program, because then it probably would have been even longer. And if you run into trouble throughout your course, you can always go to like Barnes & Noble and pick up anatomy and well, you don't have to do that, but throughout your courses, if they start talking about body parts and what they do and why it does this, like the physiology part, you can always go to Barnes & Noble or look on Amazon for little cheat sheets that will help you. And that's what a lot of us use throughout the nursing program, especially when we had to make our care plans or do any type of project. That's what we went to. But yeah, as far as me, doing so many things at such a young age, I really wasn't that great of a high school student. Like, I didn't get in trouble or anything. I just didn't care. I was bullied because I was really fat, and basically my goal was to get the hell out of there and keep it moving. Like, I never wanted to see anybody from high school again, and I haven't. I've been doing my own thing since high school, and when I first graduated high school, I didn't really know how I was going to go to college because my parents didn't have like a college fund set up for me or any type of Gerber fund or like savings account for me. So I started digging around and found out that my community college, you can apply for the FAFSA, get a Pell Grant, get scholarships, get grants, loans. And then I just started paying out of pocket for my community college prerequisites for a different nursing program. And then I don't know. From there, I kept taking prerequisites, and then I was like, I'm gonna get nowhere doing this because I was still working full time. So when I became a CNA, I spent a whole semester getting my CNA certification and passing the state board to be on the nursing registry for CNA, and I just started working immediately as a CNA. There was a time where I was working 2 jobs as a nurse aide, 7 to 3, 3 to 11, and that was like 5-6 days a week, just because I had to make ends meet, because my then boyfriend, the guy I was dating in high school, was just not the greatest. So I had to do a lot. I had to do a lot of things on my own, and plus my father, I don't know. My dad and my mom. My mom and dad got divorced when I was really young, and my dad worked a lot. So when we were younger, he couldn't take us on the job site and stuff. So just seeing my mom have to raise 2 kids as a single mother, she was working full time and then she was bartending 3 or 4 nights a week to make extra money just to put bread on the table. She really made me want to be an independent, strong woman like her. And then with my dad, he taught me kind of the whole guy side, like how to change oil, how to check my oil filter, how to check my oil level, what different symbols on my car meant. And he always told me, if you're ever going to live on your own and someone moves in with you, make sure that you can cover their half, because you never know when they're going to walk out on you. You never know when they're going to do you dirty. And both of my parents have played a tremendous role in making me the responsible young adult that I am. And my grandmother, my Meemaw, also helped make me a very independent individual, because when she started getting sick with dementia and I had to give her medicine and feed her and clean her house and check her mail and do everything for her, there's me and my brother. And my mom needed help from one of us or both of us, and I was the one that stepped up to the plate. I was the one that was calling the ambulance when she would rip her catheter tubing out. I was the one that would ride behind the ambulance to the hospital and get her admitted into the ER and tell my mom, where we were. All that stuff. I've always been the more mature child, and I've just taken on that role for my life. I feel like with maturity, yes, you have a big responsibility, but looking at where I'm at now compared to some other people that I went to high school with, I would choose my maturity over acting like an adolescent and not responsible any day. I like going to sleep at night knowing that I have a job that helps provide a roof and car for me. I like having the responsibility of getting up and going to work and making my own money. And every boyfriend I've ever had, I've told, like, if we ever get married, if we ever even think about that, I will always have my own money. I'm always going to work. We would never have joint accounts. My money is my money. As long as my half of the bills are paid and your half of the bills are paid, that's how it goes. So that's just how it goes. Sorry to hear you were bullied. Yeah, so I was bullied in middle school as well. I went through an eating disorder. I battled bulimia for a couple of years, and I overcame that. So then I just started eating and eating and eating and eating my feelings. And even now, since my dad passed away, I've gained 40 plus pounds. And I'm not really worried about it anymore because I'm happy, and eventually I'm going to get back into that phase of my life where I start taking care of me again. I have a great job. I'm learning my job. And eventually I'm going to start getting back into the swing of things. I'm going to start drinking more water. I'm going to start eating my salads again. Now it's just convenient for me to eat fast food because I'm running around. I'm training. I'm going here. I'm going there. And I'm happy. That's all that matters. Yeah, I'm overweight. Who isn't? You know what I mean? Like, this me complaining because I'm overweight, it's like the same people that have a fast metabolism that want to gain weight. If I could give it to you, I would. You can have my fat. Like, there's something about, everybody has something about themselves that they don't like. Yes, right now, I don't like seeing my body. I don't like seeing how big I am. Even looking at myself now in my phone, I'm just like, I can tell that I've gained a lot of weight. My face is pudgy. My clothes barely fit. But a lot of this, I've always been a stress eater. And a lot of this has stemmed from losing my father so unexpectedly. A lot of people don't know the whole story of, he wasn't on hospice. He didn't have a timeline. Yeah, he had heart failure, but a lot of people don't understand that I was with him the night before I got the phone call. I saw him on my birthday. He was fine. So to go from, okay, my dad's fine, I'm here, I'm eating dinner with him, and then I had birthday cake with him, and the last thing I said to him was, I love you too, and then the next day at my job I get that dreaded phone call that nobody in the world should ever get. That's that's traumatic to me. You know what I mean? Like, that's hard. And me and my father, we didn't really always have a close relationship, but as I got older, we got closer. And that's what I'm so thankful for. You know, when you're a teenager, you're always busy going out with your friends, and you know, your parents set all these rules that you hate, but it's because they love you. It's because they care about you and they don't want you to get hurt. And you know, growing up, I got in fights with my parents. I'm like, no, I'm not going to be in by 11. No, I'm not doing this. No, I'm not. Um, yeah, I'll have the last laugh, right? So, you know, I'm thankful that me and my dad got so close, and I'm thankful that he got to see me graduate nursing school. I'm thankful that we became closer. You know, and I'm thankful that I have all the great memories of fishing bass tournaments with him, and I'm living in his house, so I have all these memories forever. Like when he would be in the kitchen cooking, and we would just, you know, we would listen to music while he was cooking, and we would be dancing and singing. Or I'd get on YouTube and show him music videos of some of his favorite bands, because, you know, some of them he never really saw. He didn't like technology, so he didn't really understand how stuff like that worked. He did text, but he had a flip phone. We called it the dinosaur. So he was never really into stuff like that. But losing a parent, losing someone you care about, especially if you really care about them and it's sudden and unexpected, you know, people deal with grief, people deal with trauma, people deal with all kinds of life events differently. And my way of dealing with things like that is to eat. Same thing with my grandma. When she passed when I was younger, I ate and ate and ate. And then I eventually came around and really started taking better care of myself. And just like now, I'm eating and eating and eating. And eventually I'm going to be like, you know what? Enough is enough. You need to start working out again. You need to start taking better care of yourself. And, you know, it's going to happen. I did it 2 years ago, because I was down to 137. And then my boyfriend broke up with me. So I ate and ate and ate. And then I started taking better care of myself. And then I met my new boyfriend, which I'm with now. And then my dad. So it's just a never ending cycle for me. And it's really, yeah, it's really hard to struggle with a mental problem like this. I mean, you know, it's just like a drug addict, you know, when they're feeling depressed or down or they want to be lifted, they go to drugs. When I want to feel better, I go to food or Starbucks. I got Starbucks today. And I shouldn't have, but I did. And it made me happy at first, and now looking at it, I'm just like, you know, you don't need that. So I'm going to work on myself eventually. Just got to give it time. That's really all. And that's all I got to say about that. So, oh, and another thing. When you start working, wherever you work, I'm always like quiet and mellow because I like to feel people out and see like what their personality types are. And then once I get to know somebody better, I start acting more like myself, like crazy, bubbly blonde, you know. And then there's certain people that I get around, and I don't shut down, but I quiet down, because I know they don't like people like that. So I always try to respect people, and if they don't like a big bubbly person, I try not to be as bubbly around them. Not completely not bubbly, but I tone it down. But 99% of the time when I'm working, I'm myself. You take it or you leave it. That's just how it is. Did I lose a lot of friends when I started my nursing career? So, yeah, losing a parent is very hard. So, I lost all of my friends after high school. I'm just gonna be real. So throughout high school, freshman year, you know, it's a whole new world. I was getting accommodated to the whole high school thing, and I wouldn't say I wasn't a nerd, but I was really focusing on my grades. Then I started making friends, and I was more focused on making friends and being cool with them instead of making great grades. So by the time senior year rolled around, You know, a lot of people steal their parents' liquor and beer and smoke pot and do what they do. So, of course, I was being a typical teenager and doing what my friends were doing. And something just clicked in my head when I started getting my grades. And there was a point where I saw my report graduate high school. He got in a fight in 8th grade with his PE teacher, but he was very smart because he had to teach himself. For someone who dropped out in 8th grade, he was so good at math. And I would explain to him, like, Dad, you're doing trigonometry. This is algebra. This is that. And he's like, what is that? Like, he didn't even know what I was talking about, but he was so smart. But back then, you didn't have to have a high school diploma or a GED to flip burgers at McDonald's. So he created his own landscaping business, and he also had another job. So it worked out for him. But something just clicked in my head when I started getting my grades, like, I can't do this. So I got serious. Even along with the bullying, I took my anger and my eating, and I just really started focusing on myself, and I was like, you know what, I have to get out of here. I don't want to be 20 years old in high school. It's just weird. You know, everyone's going to be 18, 19. Here I am 20, and they're going to be like, why are you 20? You could almost drink alcohol legally, you know? So I just turned my life around immediately. Like, I was like, I have to get the hell out of here. I don't want to be in high school another year. Because the 4 years I was there, it was horrible. People were joking me. People made fun of me because of the people I hung out with, because I hung out with everybody, you know? And even the gothic and emo kids, like, I was friends with everybody. As long as you were a cool person, I'd talk to you. So I just turned my life around, and I started making better grades, and my goal was to get out of high school. And when I graduated high school, the friends that I was friends with, the ones that were smoking pot and drinking, they kept doing those things after high school. And me, I accepted my first, wound care was so fun in nursing school. If I could get certified as one, I would try to get like a part-time job working as a wound care nurse. But yeah, so after high school, you know, we all graduated together as a class, and, you know, people were having parties, people were doing this, people were doing that. I went home to my family. Like, I literally, you know, I took pictures with my family, and I came right here to this house with my dad and his mom and his sister, and we had a nice little celebration. And family has always been everything to me. So instead of going out and getting drunk and doing stupid things, I was spending I was celebrating my accomplishments and my achievements with the people I love the most, which was my family. And that's what meant the most to me. And then, you know, a lot of them ended up having children. A lot of them ended up getting married and being stay-at-home moms or being waitresses or doing whatever they did. And I never wanted a career like that. I never wanted to be a waitress. I never wanted to be a bartender or a teacher, because I had been taking care of, you know, my grandma, and unfortunately she didn't see me graduate, but she knew I graduated. So I just knew that I wanted to focus on myself. I wanted to focus on my career. And to this day, I graduated in 2010, and I still don't talk to anybody from my high school. And excuse me, it's kind of disappointing, because we were so close at one point, and then stupid things like drinking or smoking pot or whatever tore us apart. I never would apologize for taking the more mature route and having a responsible life. I will never apologize for putting myself first. I will never apologize for pursuing my dream of becoming a nurse, because I did that. I became what I've always wanted to become. So I'm not going to apologize for that. If they're happy being a waitress, if they're happy being a teacher, if they're happy being a stay-at-home mom, that's you. That's your career. You know, everybody, there's different strokes for different folks. That's just what they do. Can LPNs do wound care? If you work in like long-term care, rehab facilities, and they have wounds that need to be packed, some places have like a wound care team, but in my area, when we did all of our clinicals, it was the LPNs doing the wound care. We were constantly doing wet to dry dressings. So, and we also even changed out wound vacs, and that was really fun. Very stinky, but very fun. But yeah, like, that's kind of my life story. You know, I wasn't the greatest kid in high school, and then I turned my life around, and I just really started focusing on myself because that's what I like to do. And that's why now when people, even my mom says she's too old to go back to school. No, you're not. You're never too old to go back to school, especially nowadays when there's accelerated programs and there's online programs and there's part-time programs, day, evening classes. There's no excuse. When you want something, you have to go out and get it. And I think the thing that makes me the most proud of myself throughout my whole journey is that I did this by myself. I didn't have a best friend that went through nursing school with me. I didn't have, someone holding my hand. When I failed nursing classes, I cried my eyes out and I'm like, you know what? I gotta pass that class next time because I'm not gonna let this get me down. I think I failed 2 or 3 classes in nursing school, but it just made me stronger and it made me know what to do next time. You're not perfect at everything. And the classes I failed, I had crappy teachers. They made us teach ourselves, and I don't learn like that. I'm 90% hands-on, 10% visual. I mean, you can show it to me. I can read it over and over and over again, kind of understand it, but as soon as you say, Amberly, this is how you do it, and you show me, boom, I got it. Just like now. I started out writing things down in a notepad at my new job, and watching them maneuver the whole computer system, I was like, there's no way I'm going to be able to do this. So then they let me log in with my login and play around, and now I'm not a pro, but I'm in there, and I'm getting stuff done, let me tell you. So you just have to do what works for you. You have to do what you want to do. If nursing is what you want to do, go for it. If you want to be a teacher, go for it, so on and so forth. Different strokes for different folks. You have to do what makes you happy because in the end, you are the only person that is going to be there for yourself. I'm living proof. I'm the only person that's there for me. None of my friends from 8+ years ago are here with me now because I took a different route. And that's cool. Like, they probably think that, I feel like sometimes people think that because you are a college graduate, you think you're better than somebody. That's not true at all. I just decided to go to college. I decided that I didn't want to be a waitress. I didn't want the career path that some people choose, and that's completely different, just like they didn't want the whole college career path. They took a different route, I took a different route, and unfortunately that brought us apart, but crap happens. That's just how it goes. Life is forever changing. So your best friend that was your best friend 15 years ago might not be your best friend today. That's cool. I have nobody. I had my mom, my dad, my brother, my meemaw. Then my meemaw passed away. Now my dad's passed away, and I have my mom and brother and my boyfriend, of course. But that's it. I don't have a best friend that I can cry to. I don't have a best friend that I can go shopping with. I just have myself, and I'm perfectly okay with that. My dad was kind of, I wouldn't say a loner, but he was used to being independent and doing everything on his own, and I think that's where I get it from. That's also why I'm so stubborn. That's why I don't like people doing stuff for me, because my dad taught me, when you want something, you do it. You go get it. You want a new car, you work for it. You want a new stove, save up for it and buy it. He's always taught me like that, so that's where I get my independent streak. But, yeah. What are you doing? My cat is napping. You napped all day and you're still napping? What do you think you're doing? So, that's my update. We really, I'm freezing. The AC is on and I'm cold. So yeah, you're right. But that's just my update. I just wanted to catch you guys up on my life and answer any questions that you guys have nursing related or life related. I haven't really been making videos lately because I've just been so busy training at my new job. Yes, so me and another nurse today were talking about this. My new saying, like, you know, when you're in a conversation and someone's like, oh, what do you do for a living? And you say, oh, I'm a nurse. Oh, an RN. My number one comeback now is, why does it matter? If you were to drop on that floor in cardiac arrest, I would be able to save you. That is what should matter. I took the same state board that the registered nurses take. Okay? So I could save your life if I needed to. That's what matters. I can give you your B12 or testosterone or Depo-Provera injection just like the next registered nurse behind me. So don't, I agree with that 100%. I never let people put me down because my title is LPN, not RN or not RN BSN or RN BSN MSN, any of that. I am a nurse. I care for people, and my role is just as important as an RN, RN BSN, RN MSN, whatever. We all work as a team, period. So, my phone's about to die, but I just wanted to hop on here. Oh, this is like an hour long. I'm so sorry, you guys, but I'll probably post this in case somebody like wants to rewatch it that hopped on late or something. I don't know. I don't really post a lot of lives, but my battery is low, so no, I am not a first responder. I am a nurse. You're welcome. I like doing live, so I'll probably try to go live like once a week. And if anything good happens at work, I'm going to fill you guys in, of course. So that's it for tonight. I hope you guys enjoy your Tuesday. And I look forward to making a new video for you guys soon.